July 5th, around 2 o'clock, my car blew the engine and caught fire. I was trying to grab some stuff from the center console and a flare of flame hit my leg. And this is just a series of pictures showing the progression since then of this damage to my leg. This video will show some of the techniques for treating a second-degree burn over such a large area. I've been taking pictures for a week of my second-degree burn that I got from my car that caught fire, like I say, almost a week ago at this point. Second-degree burn. It started, the first day that I had it, it was just red and dark. Like most of it was this sort of color. The next day I took a shower and a bunch of blisters showed up, including this one, which broke open almost immediately. And one way down over here kind of broke early. I tried to keep them all together, doing the right thing. Try and keep them intact. So this is a video on how to care for wounds. First of all, go see a doctor. I saw the doctor and nurse practitioner, and she's like, "Oh, okay, yeah, here we go." You will want some antibiotic cream for sure. Again, if it's any worse than just some blistering, you need to go to a doctor or hospital right away, and they got some serious stuff there. But Neosporin, scoopy stuff, you smear it on. That's good. Well, I should step back a second. First step, clean it. I took a gentle shower and took care not to, rub it or anything like that, but just washed it off. Once it's clean, and let's see, we do have tools for that sort of thing. Surgical sponges. You can use that. Don't use stuff that has lint, like paper towels. That's horrible because then the lint will stick to you, and that's no good. And of course, various brands of material can help you. There's Band-Aid brand, Johnson & Johnson, basically. Rite Aid has their stuff. CVS has their stuff. There's good materials out there. Just say it that way. So, anyway, the next step is non-stick pads. For sure, make sure that it's non-stick. It's a generic brand. Might work well. Again, listen to your doctor, or listen to the nurse, or whatever. Do the right thing. Plain gauze pads. Once you get the non-stick stuff on, let's step back. Neosporin first. Keep it soft, keep it protected, keep it, any yellowing, any traces of red or heat that comes up or down your leg or something like that, in my case, that's what I've been looking for. Thankfully that didn't happen. If it's yellows and you got that kind of weird stuff going on, or a hot line coming up, that's a blood infection. Run to the hospital. So far so good with this. I mean, it's painful and annoying as hell, and feels like getting a knife stab periodically. But other than that, it's okay. I've kept in touch with various people who are medical professionals. So do Neosporin first, right? I had here it is. This is sort of a generic tube by CVS. Same kind of stuff, right? So that's step one. We'll coat it with that. Step two, non-stick pads. They do make big ones, so I got a couple of those, although I'm running low now because every day or so, or even twice a day, I got to rechange all the dressing. So I got big ones, I got small ones, I got tons of them. That's step two in this process. I do have, my knee has a scrape. It's okay to have the flexible bandage on that, so that's nice. You will need paper tape to hold things in place. Then I wrap the entire thing in gauze wrap over the bandages. So try to get all the affected area, so to speak, covered with the nonstick pads, wrap it in this. Now finally, for lack of a better term, second-degree burns start oozing. I discovered these, which is surgical dressings. It says quick lock technology, absorbs fluid in 1 second. And it says, you know, for heavily draining wounds. I have a heavily draining wound, no doubt there. So there's the arsenal of equipment. Right, so there's the wound. Pretty awesome. And by awesome, I mean horrible. So we'll start with the basics, which is things are in containers and they're sterile until you open them. Tape goes over things but not onto the wound itself. That will rip off the next time you take that, so no sir on that. Let's pull this closer. You can see my arsenal, as I say. Alright. So, first thing, triple antibiotic, as stated. And I washed my hands so we're clean. And I just intend to take a big goop of it, right? And I'll start from the bottom and just gently smear that on. You know, sometimes these wounds are super sensitive and you'll be like, ow, ow, ow. You know, be careful. Let it warm up, so to speak, so it gets a little more fluid. And that way it can cover your wounds. Keep track of where you're smearing this stuff, because you want to make sure you get full coverage. If you miss anything, you know, you just want to keep it moist and protected from bacteria, of course. That's the most important thing. Infections are the worst, especially when you're talking burns. Your skin is your protection. When you get a burn, you know, kind of like this or worse, you're vulnerable. So then, you know, things like this become helpful parts of the protection. Again, if you're not sure, go to a hospital. They know how to deal with burns. Probably see them all day, every day. Go to a wound care place if you get that sort of specialty. You know, primary care doctor, of course, if you have to get the referral, but you know, do what you got to do. In an emergency, you deal with the emergency. You want to live. All right, so we got that on. That's cool. Next steps, right? We got our layer of triple antibiotic, and let's get the Neosporin on the side. We don't need that today. Wipe my fingers off. So I'll do that a bit. Alright. Now, the giant nonstick pad. I did have 10 of these. I've plowed through an average of like 3 or 4 a day, unfortunately. But boy, it's nice, because then you don't need multiple of the smaller pads. That's the best I can say about that. So there's less chance of movement. So I take this and I put it over the biggest part of the area. There's instructions right on the package. Peel down to open. It's a little small, but there should be one end of these packages where you split it like this. You know, it shouldn't be too much of an effort. Some of them you have to tear off the end. This is peel. So when you start peeling, keep in mind it's sterile inside. So I'm going to go like this. Hold on to what's inside so it doesn't fall, right? I'm using the inside of this. And then I'm going to place this on the wound. I don't care about that paper. That can go to the floor. I don't care. I gotta get this on the wound properly. Get some good coverage. Alright, so we do that. And the triple antibiotic acts not quite like glue, but stuff will friggin' stay there, and that's nice. Right? So, let's lighten that up a little bit. Okay, great. And, yeah, alright. Next step, I have more over here. Okay? There's just more area that needs coverage. This is very vulnerable. There's the open blister that broke open, and below it's an area that blistered up and has collapsed since. So we'll take care of that next with some of these non-stick pads. Again, the major brands are good, right? Now this is good. This says non-adherent pads. I just want to point out, for dressing light draining wounds. So the heavy draining wounds, that's where we got to go with this stuff, right? Most of my leg is light draining. The bottom portion, though, it seems like underneath that dead skin, it's kind of draining down there. I'll put one of these surgical dressings down there. But up here, I'm just going to put regular pads. Again, I'm going to peel and see where it's going. Okay, I can grab it with the inside, grab the corner of this puppy. I like to say that I lay these out like shingles, so anything that wants to drip inside, it's going to stay inside. So I'm going to do this one over here, kind of angle it so it's covering the wound more than anything. I need another one, obviously. Oh, I got another one right here. Peel that puppy. And once you get good at this, you just pick it out and put it on. Right? Some good coverage on the wounds. That's what's key. The coverage and protection. Obviously, if you have a wound like this, don't do heavy activity. Luckily, this is not on a bending joint or something. If that was the case, you want to try and keep that not flexing as much as possible. That's just a generic tip. Guess I'll use a third one. See, this is why I like the long ones. I could have done another long one, but now I'm plowing through 3 of these 3x4-inch pads. Life's rough, so be it. Okay, and this part is sort of triangular here. So I'm going to put that like that on there. Again, like I say, it's getting some good coverage. Okay, so there we go. I'll put some tape just to hold corners of this where the pad is not next to some exposed skin, so to speak. I'll make sure that that's done because we don't want this shifting around, right? And this is a nighttime exercise for me. I did this earlier today, especially at night, sleeping, tossing and turning. The pain pops in once in a while. So we'll start at the top, get that taped in. This big one over here, I'm going to tape that one over like this a little bit to my leg. Just keep that in place. We'll keep these couple pads locked in with each other. I like that idea, so it's all one unit. I have a joint here. I want to be careful that that joint is closed up. I'm going to lock that puppy together. Gently get that cloth tape on. And definitely cloth tape, friggin' rules. Don't do wimpy tape, whatever you do. You want the good stuff that will actually stick. So let's see here. Sticking. There we go. Okay, that'll stick down there. Also, you want to kind of get your leg in a spot where it's bent enough, right? So that you're not pulling the tape or having it too tight when you bend your legs or, in my case, arms, whatever you're doing. Let's get that over there. This bottom part over here, got to dry off a little bit. Wipe off the excess a little bit. And think about whether I'm taping that. Probably will. Do a little tape over there. So let's do that. Oh, let's see, I'm flexing my leg down. And get that over there. Okay, now, so this is kind of like a unit. All one non-stick pad area on top of the triple antibiotic. I don't like this. This is lifting up, so I'm going to do a little piece of tape there. I just want this stuff to stay on its own, and then the outer wrapping will just help lock things in place. So, before we get there, let's throw away all this paper and stuff, is the draining. So I've had a lot of draining come out on the bottom here. The last 2 or 3 days especially, it's been crazy. So I went and got this stuff, and these things are awesome. Hopefully I'll be able to get through the night with one on my leg. That level, once I'm laying down, there's less pressure on the fluids, right? You're standing up or sitting. Your pressure, they recommend you elevate your leg or whatever part of your body has a wound so it doesn't have that pressure. Fortunately, if you got to work during the day, so be it. Now, the instructions on this surgical pad say, for best results, apply dressing with blue line facing away. So there is a blue line in this pad facing away from the wound. Now, in this case, this is just kind of regular skin here. It's just kind of capturing things. I could put this on here if this whole thing was oozing. It's oozing a bit, but not so much. So I'm going to put it like way down here, and it'll capture whatever's going on down there. And then finally I'll wrap this up, literally. So let me get my paper tape going. This is where having dexterity helps. So let's do that. And I'm just going to get this onto my ankle. Wrapped around a bit. Good. Now I'm going to, again, I got overlap with my non-stick pads, so to speak. Oops. Get back here. If I was on top of the wound directly, I'd be a little more concerned, but in good shape here. I'm just going to wrap that around to the tape on the other side, and maybe just loosen that up so I'm not constricting my ankle, but just holding it in place. That's what's key. So this is staying in place. I've got protection here, and again, if this was oozing a lot, I'd be putting on these surgical dressings more, but I don't have to. So again, cloth tape, it's awesome, it's strong. Don't use paper tape. I think paper tape is no good. Not any good experience with it over the years. So this is just gauze wrapping, and plainly speaking, it's just to kind of hold things and protect it. So in theory, you could wrap this and have itself, tuck it under itself. I don't trust it. So start with a piece of tape on the front side of it, then I'll wrap over it and wrap it down, and then work my way back a bit. So we'll just kind of, again, put that there, and wrap it around. Now, so you want to wrap over the starting point, then overlap, I guess, by 50% or so in general when you're doing gauze or whatever other wrapping, sports wrapping, that sort of stuff. So I'm using gauze. Gauze is breathable. Breathing is good. You kind of don't want to lock in too much what's going on down below here. I am wrapping it not too tightly because you don't want to cut off blood circulation. That's the worst. You want to make sure you got blood flow. I guess that's another tip. If you've got like blue or lack of, it's apparent that below the wound you're not getting blood, you go hit that doctor right away. Don't fool around. Infections, blood flow, I guess that's the most important things to worry about. So that's wrapped up to that point. And then this pad should capture the liquids. That's a lot. That's where we are. So now we have a good coverage system all the way down and including where the ooze might come out at the bottom. So that's it. Always keep a supply handy of what you might need. I've got EpiPens for my kid, but the rest of the stuff, by and large, plowing through it. Thanks for watching.